Okay, so the second step in this treatment process will be to focus on this vastus medialis, and as we saw before with Isaac, he's got a really healthy vastus medialis here. We're going to stay in the same position, okay, so we're going to have the knee still in flexion, obviously nice and relaxed, but all we're doing now is that because we're picking up this vastus medialis, what we're going to do is we're going to actually drag the tissue back towards the lateral, okay, and then we'll lock down on that vastus medialis there, okay, and we will strip along the length of that vastus medialis. Now this looks quite simple, but there's a bit of an art to it here, because what will happen as you come up to this vastus medialis, it basically will blend out and then you'll come right up against the rectus femoris. Now, it's important that you don't just roll over it, okay, which is what does tend to happen. I've seen a lot of therapists over the years do a lot of work where it flicks over that rec fem, and that's not ideal, okay. So we want to be really purposeful, and in terms of our direction, we're going to place it all onto that vastus medialis, like so. Now, there are two trigger points in vastus medialis, which, once again, they are important, but from the point of view of dealing with patellofemoral joint dysfunction, those trigger points, they play a role, but not a massive role. So we can focus on those. So you'll have one down here, basically in the lower half of the belly of the muscle, and another one coming up towards that rec fem insertion. So, you know, if we think about the vastus medialis as like a big teardrop, that's the shape of the vastus medialis. So obviously as we come up towards, you know, the top of that teardrop, obviously we want to blend off there, okay? And if you blend off, obviously you're going to have the adductor group here, and obviously you've got the rec fem obviously on that lateral part of it, okay? So coming in, drag across to the lateral, okay, and then along the length of that vastus medialis, okay. Now remember, the vastus medialis and the vastus lateralis play off for basically that whole patella tracking, okay. So it is important that we do a bit of work on here, but obviously our focus is going to be a lot more on that vastus lateralis because that's where we're going next.